Worldwide, we are dying from diseases that were once unheard of. Each year, roughly 10 million people die from cancer and 20 million from heart disease. Alzheimer's disease affects almost 50 million people, and 500 million of us have diabetes. Less lethal, though highly relevant, 40% of men over 45 have low testosterone, and 10% of women experience menstrual irregularities and infertility. All of these disorders and more have one thing in common. Each of them, to varying degrees, is caused or exacerbated by a change in the actions and levels of the hormone insulin, a condition known as insulin resistance. And you might have it. Odds are you do. It is the most common disorder worldwide. The problem will get worse before it gets better. Answer these questions to yourself. Do you have more fat around your belly than you think is healthy? Do you have high blood pressure? Do you have high levels of blood triglycerides? Do you have patches of darker skin or small bumps of skin around your neck, armpits, or elsewhere? Do you have a family member with type 2 diabetes? For women, have you had gestational diabetes or PCOS? For men, do you have low testosterone? If you answered yes to 2 or more of these questions, you're likely insulin resistant. One reason insulin resistance is so common is a result of an incorrect perspective. This perspective is also why type 2 diabetes has become epidemic, because it's wrong. Diabetes mellitus is not a glucose disease. Diabetes mellitus is an insulin disease. In all aspects of life, a proper perspective is crucial to comprehension. If we view diabetes as a disorder of insulin rather than glucose, we come to a new paradigm. When we consider type 2 diabetes to be a problem of excess insulin rather than simply excess glucose, 2 essential changes occur. We identify the disease earlier and we treat it better. First, insulin levels can be elevated decades before blood glucose levels begin to rise. This is a result of the body needing to make progressively more insulin in order to control blood glucose. In these early stages, insulin is elevated, but blood glucose is still normal, a state we know as insulin resistance. However, eventually, the body becomes so resistant to its own insulin that blood glucose begins to rise, and it's only then, with the rise of glucose, but not insulin, that conventional clinical diagnostics detect the disorder and classify it as diabetes. Again, the tragedy is that this glucose-centric perspective delays the detection of the disorder by several years. Second, a type 2 diabetic enjoys better health outcomes if we focus on lowering insulin rather than just lowering glucose. The disease is simply a prolonged state of elevated insulin and a progressive loss of insulin's actions, or in other words, insulin resistance. If we merely try to control glucose, then a direct strategy is to simply increase insulin even higher. Of course, the most effective method to increase insulin is to inject insulin, increasing the already elevated insulin levels. Injecting insulin in a type 2 diabetic will indeed lower blood glucose. Tragically, it also makes everything worse.
Y recuerda, controla tus carbohidratos, prioriza la proteína, no le tengas miedo a las grasas saludables, no azúcar, no alcohol, no comidas procesadas, sin trampas. Me gustaría escuchar tu historia de éxitos. Compártelos en el enlace de abajo.